Hi, Dr. Terry Chambers today, and this week's blog is about myofascial pain. Now, myofascial pain, or myofascitis, is the pain that's often associated with whiplash injuries, neck injuries, or back injuries that involve the muscle, the ligaments, the tendons, and the fascia, which are the areas that are often injured in a soft tissue injury or in chronic conditions that seem to never go away. Now, the reason I want to talk about these is that these are very treatable and very easy to be resolved if you know how to do them and you understand the mechanism behind them. So I have a chart here that kind of shows you the muscles that are involved with the upper back. So if you were to look at the spine, you would notice there are layers upon layers upon layers of muscles that are piled on top of each other. And under all those layers is this thin layer of fascia that separates the muscle from the bone. Now, most people are familiar with fascia when they think of pleurisy. Pleurisy, which is inflammation of the fascia between the bone or the lining and the lung that causes severe pain, coughing, and sneezing, is what fascia is. So when you have myofascial pain syndrome, it's like having pleurisy in the muscles, and that's why it's so painful when you use it. Normally, if you remember high school biology, you eat food and to get energy called glucose, but that energy has to be stored in the muscle as glycogen. Glycogen is the stored energy. And then when you have to use that stored energy, either in exercising, doing work around the house, you release the normal sugar, glucose, for use, and a waste byproduct called lactic acid, and that's what makes your muscles sore. But if you've had an injury to the muscle where the blood supply to the muscle has been cut off, that lactic acid does not get removed. It just accumulates over and over again, day in, day out, into the muscles and forms little spots called trigger points. And those are the sore spots you feel when someone pushes on your back, pushes on your neck. If you have a lot of sore spots throughout your neck and back, those are called myofascial trigger points, or what I'm talking about. You still have to use the muscle, so the muscle gets tired when you use it faster because you cannot get good blood supply to the muscle to allow the muscle to heal and restore new energy, such in the form of glycogen and new cell production. So a person who's suffering from chronic pain is because they have issues with this kind of a condition. So how do you treat it? Sometimes the easiest way to treat it is to do what's known as trigger point work, where you take your thumb or hand and you find the muscle and you push real hard until you find the sore spots and you dissipate or cause the trigger point to dissolve back into the muscle, and then you use heat and electrical therapy to flush the muscle out. And the reason you do that is the muscle will get stronger over 4 or 5 treatments to where then you can start exercising and make the muscle feel better and you can get stronger. So those of you who have neck and back pain, exercise and it gets worse, or have chronic muscle soreness with sore spots, it's myofascial pain. And myofascial pain is very treatable and very resolvable. So if you have any questions, you can contact me at my office, 304-263-4927, or you can go to my website, chamberschiropractic.com, and there's more information about myofascial pain. It's nice talking to you. I'm sure we have such a short time. See you next week. Bye.